Hey, I'm Chrissy with Finding Hope for Frizzle, and I just wanted to share a little bit more about our gene therapy program for Frizzle disease. So a couple weeks ago, we announced that we had partnered with Aperture Gene Therapy to license their TfR1 CapX technology. So what does that mean? Well, I'd love to explain that a little bit more and why it's so important to us and why we're so excited about it. So we're pursuing gene replacement therapy. Basically, Frizzle has two non-functioning Frizzle genes in the brain, the patients do. And we need to get them a good copy of Frizzle so that the cells will read it, rebuild the AMPA receptors, and that messaging in the brain will be restored and motor function will be restored. When we tested gene replacement therapy in Frizzle-bred diseased mice, we saw the mice brains and bodies come back to function. And that's what we want for our Frizzle patients. So how do we get the good Frizzle gene to the brain cells of our patients? We use a viral vector. So I like to talk about it as like a suitcase. You have a suitcase that you put the good copy of Frizzle gene into, and then it has to get into the brain cells in the brain to open up, deliver its good Frizzle gene, start reading it, and restore function. That suitcase is a viral vector, so of empty virus pretty much is what it is, because viruses are a great mechanism to penetrate the brain cells to be able to deliver the therapy. And so we specifically, for our suitcase, are using the TfR1 CapX technology. It's a viral vector that's been engineered. And why we're excited about this is for two reasons. One, this specific capsid is engineered in a way that it can get better distribution throughout the brain to deliver more therapy to the brain cells. We need as much good Frizzle gene into each brain cell as much as possible to be able to see recovery and restoration of function for our Frizzle patients. Along with that, the second reason, and they're tied together, is that this specific capsid is actually administered intravenously, so through an IV in the arm. And this is great because it's less invasive for our patients, but in the brain, there's blood vessels all over the brain. So when it's given intravenously through the blood, there's vessels all over to distribute it, to cross from the blood-brain barrier into the cells and to deliver the therapy. And so we are excited because we want to deliver as much good Frizzle to as many cells in the brain as possible. And this capsid, this new technology, brings the hope of better distribution throughout the brain to be able to see more therapy provided, and we hope to see more recovery for our patients. The other part that's exciting about it being intravenous is that is scalable at a global level. Our Frizzle patient population is all over the world, and we need a therapy that we can distribute all over the world to our patient population. And this is a better way to be able to do that, because traditional methods of gene therapy actually are given through the lumbar, or basically brain surgery. It's given through the base of the skull or through the top of the skull, and that is really hard to scale globally, and it's also really hard on the patient population. So we are excited about the TfR1 CapX technology, that we are going to see more distribution of our therapy in the brain for our patients, to see better recovery, as well as to have it be less invasive for our patients to just have an IV put in to receive their therapy. So I hope that explains a little bit more about what is going on with our program and what we're doing, why we're excited about it. We will be the first in human using the TfR1 CapX technology, and we believe that showing that this works in a human, that this will change the landscape for all gene therapy, for all rare diseases, diseases that are pursuing gene therapy as their treatment mechanism. So we are excited to see this science move forward. We believe in the research and the data and the testing that backs this technology, and we're excited to see this happen for our patients and to see recovery restored so that we have Frizzle patients come back to function. So we're very excited, and we hope that helps explain a little bit more of why we are talking about this so much and why we're excited to see it move forward to our patients.